So hi everybody. I wanted to offer up a little video to show you some of the things that I was doing to help my mom. My mom has recently had hip replacement surgery, and I've always known kind of what I might do, but I've never had a live body that's only a week or two out of surgery before to actually apply some of these techniques to. So I wanted to share with you some of the things that are really working well for my mom, and to let you know that this is possible when you use yoga therapy. She was given some physiotherapy. She went to a local rehab hospital for a week after her hip replacement. It was a total hip replacement. It was done through the buttock rather than the anterior procedure. And the physiotherapy she was given was a few exercises designed to bring hip mobility back, because she had hip surgery. And it's things like, 15 reps, do 3 sets of that, and blah, blah, blah. So we've taken a bit of a different approach with our yoga therapy, and let me show you some of the things that we're doing and why it's different than physiotherapy and why you might want to think about this. This particular routine might be helpful for people who have hip pain, have not had surgery yet, or even knee replacement or knee pain. It all kind of comes together and it's safe. I'm going to use a chair. We're using a chair a lot in our work, and any old chair kind of will do. You can see this is one of our patio chairs. Doesn't even have a cushion on it, but that's just fine. The other prop that we might find helpful is a yoga block. If you don't have a yoga block, I think my blanket will be a bit helpful. If you don't have a yoga block, then you could use a cardboard box in this shape, or even a full box of Kleenex or toilet paper. Works fairly well. And I'm using the block to keep the thigh bones perfectly parallel in this first pose, which is seated mountain pose. We want to really work on bringing the thigh bone into a neutral attachment to the hip socket. So even if you're talking knee pain, which many of us might be talking that, the dysfunction in the knees that's causing your pain probably has something to do with the hips. So teaching the hips to move in that nice parallel way when you're walking, climbing stairs, doing your sports, will help reduce the bone wear and tear that we're experiencing that's causing our joint pain. So just seated mountain pose for a few breaths several times a day is a great rehab technique to start realigning the muscle. So I'm not pushing my legs together, I'm not gripping the block with a death grip or anything like that. I'm just re-educating the muscles, the connective tissue in particular, that this is a good way for me to move my body. So I've got the feet placed into the ground, knees straight ahead, spine erect and long, shoulders relaxed. And I'm breathing deeply in and out through the nose. Wonderful. Then I'm going to start a little bit of movement with the feet. And you might think, well, why are you doing feet movement when we're talking about hips and knees? Well, I'll explain. On your first inhale, lift your toes, fan them up. Exhale, see about gathering the toes into the mat. Inhale and exhale. So the bulk of your foot's still on the floor. You're just moving your toes. Then come up onto the balls of the feet and rock back onto the heels. We're trying to keep the ankles in 2 straight lines with each other. So I'm going to exaggerate here, but we don't want to be wobbling all over as we do this movement. Good. And notice all these movements are timed with your breath. The next movement on the inhale, take the feet out to the outside edges, and as you exhale, inside edges of the feet. So back and forth. The block is helping your thigh bones stay in that perfectly parallel position while you move your ankles in more mobility and more mobility. And then you can do some ankle movement like this too, just to really stretch it out. So ankle movement is so important, because when you're walking, if your ankles are stiff and unresponsive, then your knees and your hips will have to do more mobility. They'll be stretched beyond their natural capacity. So we're working a lot with my mom with some foot mobility, ankle mobility. Notice the difference already with the connection of your feet into the floor and the responsiveness, the sense of energy moving there. Now let's practice getting up from the chair. When you have pain, is this the kind of way you often get up from the chair? So we want to work a little bit on strengthening the mover muscles. You might have to bend your knees at a bit more of an angle, take your knees a bit wider apart so you have a wider base. But we're going to practice getting up without using our arms. So can you take your hands to your hips and then press into your heels and lift your buttocks up from the chair. Come back down and lift. So even if you're imagining this movement, I'll talk more about that in a minute, even if you're imagining this movement, you're getting a lot of benefit here. And then eventually you might push right up without having to use your hands at all. So that's a way for us to really start to build a lot of strength in those mover muscles. I'm going to move the chair now so that the back of the chair is facing me. And this is really helpful to take weight off my sore joints. Before we go into anything with that though, just make sure you kind of give yourself a little bit of movement through the upper part of the body as well. This is all part of the joint freeing series. You can see 4 different versions of this on my website. So feel free to explore. There's one where you're seated in a chair, one where you're laying down on your bed. So there's lots of different options, but you want to get all the energy moving. This is one of the things that I think yoga therapy offers that other modalities sometimes forget about, is how to work with the subtle energy, where the healing really comes from. So we're starting to work with that joint freeing series. Now we'll find standing mountain pose. We want to make sure we're honoring that same architecture that we had when we were seated. So the 2 thigh bones parallel with each other. Toes facing straight towards the chair, kneecaps facing straight towards the chair, the bumper bones facing straight towards the chair. And we can have the hands resting on the chair just to take a little weight off any sore joints. But at the same time, we don't want to be leaning into the chair. That's repeating the pattern that we used when we were trying to walk. Maybe before your joint replacement, you had a lot of pain and you had a bit of a limp. We want to try to find a nice erect, straight posture, using the chair to take a little bit of weight off the joints, but still starting to bring that muscle tone back so that we don't have that same limp problem. Just going to get my block out of the way so you can see a bit better. The next movement is strengthening the ankle joints. So inhale, come up onto the balls of the feet, and exhale, lower down. Again, try to keep the ankles in a nice straight line rather than wobbling all over. And then we'll let that go. Now, one of the things, as I mentioned earlier, that's different between yoga therapy and physiotherapy is the amount of repetitions. Physiotherapy might expect you to do that once a day or 3 times a week, whereas yoga therapy wants you to do these movements regularly throughout your day. So rather than doing 15 reps 3 times, maybe you only do 4 or 5 movements. But then later on in the day, you come back to it, you do a little bit more, you do a little bit more. So throughout the day, you've done these little tiny mini practices, and you've done your 45 repetitions throughout the day, but it's been broken up. This allows not only the muscles to rest more, the connective tissue also has more time and more reinforcement of the new patterning. So it helps to break up the old patterning of movement and introduce new patterning of movement in a very compassionate and intelligent way. One more movement from here if you like, and this really strengthens the posterior kinetic chain. You're going to keep the knees in line with each other, and if you have a leg that's been operated on, for example, if your right hip was done, you're going to weight bear on your left leg to start with. So go on the stronger leg first. When you shift your weight over to one leg, don't shift your whole body over, stay in mountain pose, and then lift this foot up as high as you can. Keep the knees in line with each other, flex the ankle, and this might be the place where you want to be. You might need a little bit more open angle in your knee. It doesn't really matter. We're going to pulse lightly from here. Exhale, inhale, exhale, inhale. Notice my body's not moving. I'm using the chair to find balance and for a little support. Good. And then let that go, come back to mountain pose. Know that you can sit down in the chair and rest whenever you need to. And it's good to take lots of rests. Now we're going to think about weight bearing on the side that's more sore. And you may have to just imagine that for a few weeks, especially if you're close to post-surgery. Weight bearing on that leg might be too painful at first. But you know, if we had your brain hooked up to all those machines, we would see the part of your brain that fires those muscles start to activate even though you're not actually doing the movement yet. So you're building strength. The connective tissue is getting all stimulated and getting ready to support you. So if you need to imagine the movement on the second side, that's fine. I'm going to show it from this side without the chair. I want you to stay where you were with the chair because I want to show the standing leg and how important the position is. Sometimes when you come onto the standing leg, do you see what happens here? I kind of do this compensatory kind of leaning. Now I'm really exaggerating. This is not strengthening your hip. It's not keeping your hip and knee in a happy place. So when you come onto one leg, see if you can keep this hip lined up with the knee and ankle on this side. So that's something to practice before you come into the full posture, especially with your sore leg. It goes for the other side as well. I just wanted to demonstrate it more for the sore leg. When you get to the safe space to weight bear on your sore leg, let's come into the same thing. Exhale, inhale, and just a couple times. Now you're holding onto the chair because I don't want you to fully put your weight on your sore leg. You want a little help with that. Perfect. And then come back to standing in mountain pose. Beautiful. Let me show you another pose that you might not think about for rehabbing hips and knees. It's lunge pose. And usually if that came up in yoga, you wouldn't be able to do it because it would be weight bearing on the knee or it would be too much flexion for the hip. But we've modified this, my mom and I, and she really likes this pose and she's getting very strong at it. Take the sore leg or the operated on side and step that leg back. The front knee is bent so that it's right over top of the ankle, and the back leg is strongly stretched out, the heel straight back. So sometimes you have a tendency to turn a little bit. We want to keep our hips square to the chair. We want to keep this leg neutral in the hip socket, but in some extension. Contract the gluteus muscle, contract those hamstring muscles, so that posterior kinetic chain again. Press into the front foot. All sides of the foot down there are well grounded. Contract, really working the thigh muscle here. And a lot of times tight hip flexors are one of the contributing factors to our joint discomfort. So this really helps to move into stretching the hip flexor a little bit more deeply. So if that's available to you, to lift up the arm, take a nice deep breath, especially focusing on this side, on these lungs here. And then taking mountain pose again. And you'll feel quite a dramatic difference between the two sides. It's a very powerful pose, but when you're trying to build your strength back up, you want to get rid of that limp that developed when you had sore joints. So we're really trying to get stronger. You can take a seat in your chair and rest if you need to, or else we can move to the other side. Now we're kind of weight bearing a bit more on the sore leg. So make sure you're using the chair. You just don't want to lean too far into the chair. You want to be using your core strength to stand up as straight as you can. And then you have the option of lifting this arm as well. Good. You want to be breathing as deeply as you can, getting into the lung tissue. And then mountain pose. Let's turn the chair around so it's back where we had it at the beginning. And we'll just finish with a couple seated movements. You can have the block in between your knees, which is most helpful for stabilizing those thigh bones and keeping the hip socket neutral. When you're ready, let's take a deep breath and lift the chest up towards the sky. And as you exhale, pull the belly in and round out your back, kind of stretching like a bit of a cat. Inhale, lift the chest. Exhale, pull the belly in. So these are spinal stretches. Again, they're not usually talked about if someone's had a hip or knee replacement, but this is where all the energy is stored. This is where all your nervous system is contained. So we want to really look at the importance of the spine and the internal organs and give them exercise and attention as well. This next stretch is called half moon stretch, and it's very important for helping us find grounding. If you have had a lot of pain or if you've gone through the trauma of surgery, you need to feel safe again. You need to tell the nervous system that it can be calmed. So this is a way to do that with movement. If holding your arm up is uncomfortable, know you can practice with your hand on your hip. So inhale, exhale, lean out to the side. And this is a way to calm what we call in yoga the vata dosha, which means basically if you're feeling ungrounded, if you're feeling that there's been too much change in your world, this is a way to really stimulate the calming energies. Let's go to the other side. And then come back to center. This is the last movement I'd like to show you in this video, and it's a spinal twist. You know, we have to be on a lot of medications if you've had surgery or if you're on a lot of pain. It's unavoidable most of the time to have a lot of medications to help us deal with this. But all of that takes a toll on our organs. The toxicity of some of these pharmaceuticals can be difficult. So what's really lovely about the spinal twist is it gives a squeeze and a soak to all of the guts, which can really help process all the different chemicals that we have been forced to ingest during this process. So with my mom, we're practicing our safe twisting and really thinking about the health of our liver and the cleansing properties of the kidneys and the stretch of the lung tissue, all the things that are going to really help us process not just the pharmaceutical chemicals, but the toxicity from all the worry and the stress that we've been under. So it's important to stabilize the lower part of the body. I do not want to twist my mom's hip joint in any way. She hasn't seen her surgeon yet for her go-ahead to bend and twist more. So we keep this part very, very stable. Inhale, stand nice and tall. Exhale, gather the belly in and twist the upper ribs away from the pelvis. Inhale, come back to center. Exhale, twist the other way. And we'll go to each side a couple more times. Notice I'm not overly twisting my head. It's just coming along for the ride, and I'm taking my time. At this point with Mom, she's usually a little bit tired because it's we work out for close to 45 minutes by the time we're done. We usually move to her bed, or if you have access to another kind of table, you can use that. And we do a few of the lying down exercises that the physiotherapist recommends, and then I put her into Shavasana. So you might want to go and do that too. But these kind of things are very helpful if you're experiencing hip or knee pain, or if you've had recent hip or knee surgery. Another time we can get together and I can show you how to transfer up and down from the floor with your chair. That's available to you, and it's a good idea to learn that skill. It's a basic life skill. So thank you very much for joining me. Namaste.